Thank you, everyone, for attending today's virtual open house on the Masters in Patient Safety and Healthcare Quality. At this point, you should be able to see our first presentation slide, and we will go ahead and get started. I'm Kelly Curtis. I'm one of the admissions officers here in the department for this program, and I would like to introduce Dr. Albert Wu, the program director. Dr. Wu, would you like to share a little bit about your background?
Yeah, hi, thanks, Kelly. Thanks so much. Happy to be here with you today at this virtual open house. And I am an internist and a professor of health policy and management in the Johns Hopkins Bloomberg School of Public Health. I spend a lot of my time in the patient safety space and have done so really for since the late 1980s. In the last 10 years, I've spent much more time working with our Armstrong Institute for Patient Safety, which is arguably one of the most successful entities of its kind. We are in charge of both research and training, but also for safety and quality for the entire Johns Hopkins medicine health system. So we have both research and operations components, and I think that what some of our friends and even competitors say is that one way that Hopkins has succeeded is by combining research, and in particular research thinking, with operations and putting things into practice. I'm very happy to be leading the Masters of Applied Science in Patient Safety and Healthcare Quality. We are now, I think, in our 5th year. And I think that we've been, I in any case have been very happy and impressed with both the faculty and the students that we've gotten. And I think that our students have been pretty happy too. So maybe we'll, between Kelly and myself, maybe we can share a little bit about the program and hope that you may potentially join us.
Thank you, Dr. Wu. So today's agenda will include the following. An industry overview will be presented. Program details, including the curriculum, will be covered. Interdisciplinary collaboration and online learning will be described. And we'll share what online learning is like here at Johns Hopkins with over 20 years of online learning experience and the level of support that you will receive. Faculty will be presented, and I will cover admission requirements and touch on financial aid. There will be time at the end to address your questions. If you have any questions throughout the presentation, please type them in the Q&A box.
So let me give you a little bit of an overview of I would say that the patient safety landscape. Peter Pronovost, who was in a way one of the most important early advocates of and motivators of patient safety practice in the US and in the world for that matter. He was the founding director of the Armstrong Institute and our senior vice president for patient safety and quality. And he said, organizations profess patient safety as a top priority, but they're still figuring out how to manage it with the same rigor, discipline, and accountability that they do their budgets. And just about every hospital and healthcare organization does a at least competent job of managing their budget, but they don't do the same for patient safety. The statistics about safety problems, although they've been swamped a little bit by news and data about COVID, are still impressive. In the US and indeed worldwide, there is consistent evidence that on average, 1 in 10 hospitalized people is harmed while receiving care. There are at least 1.5 million preventable adverse drug events in the US every year. And in fact, the World Health Organization's issue for Patient Safety Day in 2022 is medication without harm. Estimates that suggest that the cost of patient safety problems is substantial and exceed 100 billion a year for tests that are required, for care that is required for people who are injured, as well as for malpractice, though that winds up being a very small fraction of this number. Inaccurate diagnoses may be the most common and costly medical errors, though medication errors, sort of vie competitively with misdiagnosis. Next, please. I will say that patient safety has made some progress in the last couple of years, and there are now many career paths in patient safety. There are, until 2 years ago, until the before times, there were many frontline clinicians and managers who were enthusiastic about safety and quality. But the challenge was, and still is, that there's, in general, a lack of expertise. There are not enough people in most medical centers and other healthcare settings that have the training and the scientific background to do all the things that are necessary, including identify problems, design interventions and projects, deal with all of the data, and lead. But a nice thing I would say about patient safety is it is truly multidisciplinary. There are many leaders who are not just physicians, but who are from all sorts of professions. And possible job titles, I'll only touch on a few, include Director of Quality Management and Patient Safety Officer, Medical Director or Nursing Director of Patient Safety, Director or Vice President of Quality Management or Performance Improvement, Patient Safety Officer or Patient Safety Consultant. If you look around, there are positions open at many, many organizations for one or another of these diagnoses of these job titles. Maybe a diagnosis of sorts, but we can get into that later. I think that although we've made progress, we have also slipped in the last 2 years. I think we had been steadily gaining in terms of patient safety, and just in the last 2 years, perhaps because of the distractions, well understood, of COVID, there's been an increase in many kinds of safety problems, including healthcare-acquired infections on the one hand, things as simple as patient falls and injuries on the other. And I think that we have managed to unlearn some of the lessons that previously had been on the way to becoming habits. And now more than ever, there is a need for people with this training. Next, please. So the program is a full Johns Hopkins master's degree program. It has a home in the School of Public Health and is fully accredited. It's mostly a skills-based program aimed at working professionals. It's intended to be part-time. The majority of our students are working elsewhere somewhere in healthcare. It is 100% online, and it requires 48 credits. In general, students finish in 2 academic years. There are 4 terms in a year, and people generally take 2 courses per term. There are more formal courses. There are professional development activities, and there is an integrative activity which students begin to work on in their second year to develop a project based on what they've learned that could be practically applied. Now, some people finish in 3 years and some people finish in 4 years, and there's the flexibility to do that. There is also group learning and peer assessment as part of the program. So students tend to form cohorts working with each other. We are very interested in promoting, in providing tools that students can use and providing skills. And all of the projects, for example, involve something that is practical as opposed to just didactic. There is a focus on public health. I think now more than ever, patient safety and quality are being viewed as not just a problem of that happens in the hospital, but extends out into the realm of the rest of the world. And so goals are to educate students about, again, some of the underpinnings. How do you define and measure safety and quality? How do you design safer systems? How do you affect change in organizations? And importantly, how do you change culture that is really not designed in, it simply is the way things work in our world? How can we oppose some of those forces to make care safer? We take a very patient-centered approach and are very prevention-focused. Next, please. So here's the basic curriculum. In year 1, in general, people would begin actually just by learning a little bit about the online platform. People need to take a brief course on academic and research ethics. The review, I think, is helpful sometimes. But the main course of the first term is the science of patient safety. There's also a tailored seminars in public health course. In the second term, there are 2 important courses: an introduction to the quality of care and case studies from a variety of settings and countries even related to quality and safety. In the third term, you get either education or a refresher on epidemiology, and also some development in writing and organizing and referencing and things that many people could probably use some additional work on. In the fourth term, there is a leadership in patient safety course, and also either an introduction or a refresher in biostatistics. In the second year, there is a very practical course on tools for quality improvements. There is a second term course on biostatistics. In the second term, more epidemiology and additional seminars in public health problems. The third term, there is a very useful course these days on infection prevention. It's actually led by our director of hospital epidemiology and infection prevention at Johns Hopkins Hospital, and also a course on measurement and evaluating quality and safety programs, something which I think is essential. Finally, in the fourth term, you will have already begun work on an integrative activity course in all the way back in the first term, but then there was a lab in measuring quality and safety. Again, perhaps to help give you some skills or to integrate some of your skills into this activity, this integrative activity. Next, please. This is the most interdisciplinary thing that I do. The lectures are taught by leaders in patient safety and healthcare quality. Some of the top leaders in the world you will recognize are teaching these courses from not just the School of Medicine, but the School of Public Health and also the School of Nursing. Johns Hopkins has been doing online teaching since the early 2000s. And there are now several hundred online courses. During the pandemic, it was relatively easy for us. We flipped all of the courses taught in the School of Public Health to being online, whether synchronous or not. The courses are developed with high production values. The activities are designed to keep people engaged. I think the materials are fun. All of the lectures, however, are recorded so that you can fit them in around your schedule. We don't really recommend binge watching the courses, but you can watch courses over and over again if you care to. And then there's a 24/7 help desk, which is really a benefit if you are not completely up to speed on all of the IT platforms. Next, please. I'm really proud of our faculty. I'll just mention a few. Matt Austin is our director for meaningful measures at the Armstrong Institute, and he is the principal architect of the Leapfrog Group's quality measurement system. Cheryl Dennison Himmelfarm is a nurse leader in patient safety and one of the deans in our in the School of Medicine in clinical investigation. I don't know what happened to Sydney D's bullet there, but Dr. D is a expert on quality of care and particularly quality of care evaluation. Lisa Maragakis is as I said, our director of hospital epidemiology and infection control, and in fact was our lead commander in the Johns Hopkins COVID Incident Command Center. For a year, she was probably the most powerful person in the whole health system. Jill Marsteller is a leader in particular evaluation methods. John McGreedy is someone who makes biostatistics fun. People say, in particular, many people understand statistical concepts for the very first time when they listen to him talk. Laura Morlock, who was one of the original architects of patient safety and risk studies at Johns Hopkins, is our Senior Associate Dean for Education for the whole School of Public Health. Lori Payne is the Nurse Director of Patient Safety for Johns Hopkins Hospital. In fact, she's not just Nurse Director, she is the Director of Patient Safety. Peter Pronovost, I mentioned. Mike Rosen developed team steps for initially for Johns Hopkins and for the Agency for Healthcare Research and Quality. Melinda Sawyer is now has actually left us, but continues to teach. She is the Director of International Quality and Safety for United Healthcare, and developed the CUSP unit-based safety program, which is also spreading around the country. Kathy Sutcliffe is the person who developed the concept of high reliability organizations, and is the world's leader on that topic. So these are just some of your instructors. Next, please. So what do we need to get you into the program? Do you want to go over this?
Yes, Dr. Wu, I can cover this slide, and I just want to thank you for covering both the details of the program as well as the need for these skill sets. So application documents are processed through SOFIS. It's a centralized application portal. We require a bachelor's degree from an accredited college or university. Looking for a minimum of 3 years of health-related work experience. You upload a current resume or CV into the SOFIS portal. 3 letters of recommendation are requested. And then a statement of purpose that shows how this program aligns with your educational and career goals that is also uploaded into SOFIS. For our international students, you may need to show proficiency in English, and all international education does need a course-by-course evaluation. We recommend using WES or World Education Service. So
can I add that, jump in and say that we do not require that people complete the GRE, the Graduate Record Exam. It's costly and time-consuming and not equally available to everybody. So we do not have that requirement. And I will also say that we pay a lot of attention to the essay. We are interested in people making the case that they can and will be able to use what they learn in this course to improve their performance and their possibilities in their work life. And if you can make a good case that that you can use this material, we will give you very serious consideration.
Yeah, thank you, Dr. Wu, for adding that. It's something I do share with students, that the GRE is not required and it's never been required, and that the statement of purpose is an important part of your application. And we actually have an email that I send to students that provides additional guidelines in writing that statement of purpose. So yeah, as soon as your file is complete, it will go over to the admission committee. So they do ongoing admissions decisions. We do encourage you to apply early. June 1st is the deadline. That will be here rather shortly. And we have one start a year. This year it's August 29th. The tuition is currently $1,270 per credit hour. Everyone who gets accepted into the program receives a partial OPAL scholarship of $488 per credit hour. So the student's cost is $782 per credit hour. And with 48.5 credits in this program, you're currently looking at $37,927. You pay for those credits or courses as you take them in each 8-week term. And again, there's no additional steps that you have to complete. Your admission application serves for the OPAL scholarship application. Beyond the partial OPAL scholarship, the financial aid office is there to provide assistance with federal and private loans. Their contact information is here on this slide. And they do work with students on assisting those filling out the financial aid documents. So we have time for questions. If you haven't done so already, please type in your question in the Q&A box. And some questions may be better answered individually, and we'll try to get to all your questions. So we have a question, Dr. Wu, on if somebody is currently enrolled in the Global Health Practice Certificate Program. I and have some of the year one courses, are they able to enroll in the master's program and just continue based on the courses that they have left? So I think they're asking for transfer credits for, epidemiology, biostatistics.
Yeah, so the courses, the epi and the biostat courses, and maybe the seminars or writing courses are all acceptable for any of our online learning courses, the OPAL courses. So you would need to apply to transfer or to to complete this degree program, but those courses would carry over.
Yeah, and is there a test that they have to take and then a replacement of that course?
There is no, if they've taken the course successfully, there's no test that's required.
We have a question here a little bit more on, can you take this program part-time? And that may allude to the time commitment in taking 2 courses in each 8-week term. And what we share with students is it's about 18 hours. It could be 15 hours a week if you are taking 2 classes, and that is designed for the working professional. And again, as Dr. Wu mentioned, you can take 1 class and cut that time in half. Do you want to add anything to that, Dr. Wu?
No, I think that's right. Many people take the complete the degree taking 1 course a term, which they find sort of more survivable than taking 2. To Tara's point, Tara asks, are the majority of your students working full time? And I don't have stats for all of our students, but I would say that the majority are working full-time jobs.
Yes, I would agree with that. Most people are fitting this program, whether it's 1 or 2 classes, working, 40 plus hours a week.
So there was a question about Duolingo, and I am not fluent, unfortunately, in Duolingo. So I do not believe the school officially recognizes the Duolingo, sort of scores as evidence for language competency. Kelly, I think we are interested in the TOEFL course.
Yes, I was going to email that student specifically to more fully address, requirements for the English proficiency and, other requirements for our international students.
So I would say that in general, a course, one can expect that if you look at the number of credits for a course, the number of time, the amount of time that's expected is at a minimum 2 or 3 times the number of hours or number of credit hours. So I think that for some courses, which are only 2 credits, it's possible that you might get away with a total commitment of 4 or 5 or 6 hours. Some of the courses that are 4 credits might take more like 10 hours or even a little bit more of total time per week, including attending lecture, going through the lectures online, attending some of the live activities, and then reading and doing the assignments. It depends a little bit on how quickly you work, though.
Here is a question a little bit more on the sequence of courses. What will the sequence of courses be the first few terms if only taking 1 course at a time and going with a 3 to 4 year approach?
Yeah, I think that in the first few terms, we would like you to take the courses that are most relevant to patient safety. So we would suggest that you take the Intro to patient safety and the intro to quality of care in the first and second terms. After that, I think that you can look at the terms, look at the amount of time you have, and customize a bit.
Yeah, and what I share with students is when you're looking at term one, those two classes are only offered in term one, and all the way through term two, term three, term four. So it's pretty easy if you're going on a 4-year plan that you would take, as Dr. Wu said, the appropriate class initially in that first year. And then the second year, you would just go back to the first year and take the other class. And we have tools that we provide students in working out that course progression. Dr. Wu, could you answer how is this program different than the MSN program for patient safety, quality, and risk management?
So that is a great question. And I would have to look further into what the requirements are for that program. I believe that that course is not a strictly online course. I believe that it has face-to-face components.
Yeah, it would be interesting to see course by course, the comparison, length of time, and like you said, any kind of campus requirements. And I can answer this question. It's on, is every candidate eligible for the partial OPAL scholarship? So yes, every candidate who gets accepted into the program receives the partial OPAL scholarship, for those credits or classes they're taking in that term. Is there a specific type of healthcare experience that you're looking for?
No, there is not really. I think that patient safety and healthcare quality concepts apply to just about any healthcare setting. We, in general, have focused on medical care, but in recent years, we have had dental students, or students who are, in fact, dentists. We certainly have doctors and nurses and pharmacists, but we have other people who are doing quality work from despite having other professions. And in the last 2 years, we've had students enroll who are veterinarians. So restricting this to strictly to human medicine is no longer even the case. If you believe that animals are pets are people too, then it would seem perfectly natural.
And the scholarship is provided whether you complete the term in 2 years, 3 years, or 4 years. So yes, you don't have to do any additional steps to receive that partial OPAL scholarship for the program up, graduating up to 4 years. Application fee waivers are a possibility through SOFIS. Since we use an outside application portal, you can request an application fee waiver there. I understand that the earlier you do that, the more likely that you may get that application fee waiver. There is no fee to start the application in SOFIS, but once you're ready to submit your application, it is $140. I have a busy timeline until November. What is the suggestion for that? Or should they wait to the following year in fall 2023?
I think that we think it makes the most sense to take the Intro to Patient Safety, it's called the Science of Safety course, in the first term, which begins in September. And I think that the other courses are perhaps a little bit more meaningful with that foundation. That might be the only course that we would strongly advise people take. If you could manage to do that in the first term, then I think that would be fine. Otherwise, I think I would advise you to wait until next year.
Yeah. So I think we touched on what is the duration of the course as far as the length of time to graduate with a master's. And each term is 8 weeks. There's no classes over the summer. And it is a master's program. There's no certificates awarded, right, Dr. Wu, like halfway through the program?
No, it is entirely, what you see is what you get. There is, you have a master's degree from Johns Hopkins University at the completion of the course.
There's a question as far as 100% online, but will there be any occasions for international students to attend a class or a graduation ceremony at Hopkins?
Yeah, so there are, we have not had a in-person graduation for the last 2 years. This year, we're going back to our usual routine of having a on-site graduation reception for our OPAL patient safety students. Students are invited to attend the convocation for the School of Public Health and the graduation for the university. Because we feel guilty, we are also having an alumni sort of reception reunion for students for any of the past 3 years. I think that's going to be in June. There are no classes that are available as part of the degree program. As a Hopkins student, you could take other classes, but those would be on a fee basis if you wanted to take courses that were outside of the master's series. There's a question about deadlines. There are not deadlines throughout the week, but there are deadlines at various points during a course. The courses there are 4 terms, and the terms are just a little bit longer than 8 weeks long. So there are deadlines throughout the course, but there aren't deadlines sort of within each week. You can do whatever you like during the week. So if there's a live talk on a given week, we would like you to dedicate an hour to that. Or if there is a quiz due in a week, we want you to do the quiz.
So the live lectures in the evenings can be attended live, or if a student is unable, they can review that recorded, correct?
That's correct. We would love for the live talks to be, sort of synchronous, but we understand that it's not always possible. And in addition, some people are in time zones where we have students in Europe and in the Middle East and in Asia, and sometimes it just doesn't work. You can certainly view those live talks get recorded. They're not quite as live, but you can follow the discussion for sure.
So this program touches, or this question for the program touches a little bit on the integrative activity. Does the program allow customization to allow for a project to be an original investigation aiming for peer review publication?
So the project, that integrating experience is required to be customized to your needs. There have been people who have published their a version of their integrative experience in peer-reviewed journals.
Thank you. Dr. Wood, could you describe just a couple maybe of the final projects that people have worked on?
Yeah, people have done everything from a structured literature review to things that required primary data collection, surveys, think pieces, actual interventions. It can sort of the design of the project can be something that fits what you're doing. It can be a secondary data analysis. It can even be a primary data collection effort.
Do the live presentations occur at a certain time during the week?
They tend to be at 5 or 6 in the evening Eastern time. That is because it seems that even if you're 12 hours off sync, it seems doable. It's not too late in the evening for anyone in the US, nor too early. But there are usually 3 live talks for any given one of the courses. So they don't happen every week during the course.
And again, if you're unable to attend, those are available recorded.
Yeah, absolutely. So there's a question about attending live. So if you're full-time, if you happen to be located in Baltimore, you can still enroll in the program. Every year we have a few people who are on staff in one of the health professions or another at Johns Hopkins, and then take the program. Because all of the lectures are online, there's not that much to participate in, really. Everyone, including the professors, is virtual, and most of the program material is recorded. But you can be located absolutely anywhere, and no one would know the difference, actually.
Would this program serve as a valid master's to apply for future DNP or DNP education or DNP MBA, MPH?
So I think you'd have to check with at least one or another program to see. This is a little bit technical. I think it would really depend on the nursing school. This is a Master's of Applied Science. I don't know if nursing schools, how nursing schools treat that degree as opposed to a MS or an MA or whatever else one might earn.
And that's what I suggest to students that are looking at doctoral programs, is to check with the doctoral program and on their requirements for a master's. As a skilled nursing facility operator, would this program help lower the return to acute percentage?
It could. I mean, I think that's, an important quality target for a lot of facilities is to reduce readmission or return to acute, which really is, really relates more to improving the quality of care that's delivered and the effectiveness of the care that's delivered while they are at your facility. So I think this certainly could contribute to that goal.
And I think we have one last question. Will a single faculty member be assigned to us to guide the project throughout the last year? So I think that might be a twofold question, like, do they get a faculty advisor to begin with? And then how is that last integrative class facilitated?
Right. So two good questions within that question. So every student, when they arrive, gets a advisor. That person is not strictly responsible for guiding them through the project. This is done by, there is a team that is, that sort of, you might say, teaches the integrating experience or oversees it with, and so the process begins in the first year with, sort of identifying a problem and identifying a question to be answered and a goal. And then students are shepherded through that, but they're not, there is not a single faculty member who is assigned to do that.
Dr. Wu, do you have any closing comments?
Oh, there's one more question about how recently recorded are the lectures. Some of them, which I think are our classics, were recorded 5 years ago, and some of them were recorded. Some of them have not been recorded yet for the upcoming fall. So it varies. I think that in general, we are trying to teach skills and provide tools. So what we're not doing mostly is providing a lot of statistics about, sort of up to the moment, what is the incidence of this problem or that. It is more, what are skills and tools and methods you can use to apply to problems that you confront. So with that in mind, some of the lectures I think are pretty much perfect from the start and wouldn't really necessarily benefit from being re-recorded. Others, for example, those on infection control have been updated very recently.
Dr. Wu, I see that we do have another question. I think they want clarification. Can you do this program full-time, which would mean in 1 year is usually what full-time program is.
Okay, yes. So it is currently structured so that it would be done in 2 years. We could, I mean, I think we'd be willing to think about if someone could make a case for doing it in, full-time, meaning not working full-time. They could convince us that they could take 4 courses a term instead of 2 courses a term. It's because the integrating experience benefits from your having had some courses. I think that if you were to start working on your integrating experience in the first term without having taken any other courses, it might be a little bit, it might be a little more difficult, honestly, but we'd be open to considering it.
Okay.
Someone asked about if you happen to be retired, could you take this? There's some people who are not working at all, and there's some people, we don't ask people how old they are, but we certainly have people who are undergoing career changes, and you could certainly take this as someone who wasn't working, perhaps due to retirement or due to other reasons. And then there's a question about an MPH.
Yes, thank you for seeing that.
Yeah, so this is much more focused than the MPH. I think the MPH, I see it as 2 things. As first of all, a literacy degree in the whole field of public health. And secondly, a professional degree that is required by some entities in order to qualify for a job. So if you're going to be a public health officer for a state or for the US, you need to have an MPH. So this is not that. On the other hand, we do not have courses on many of the topics that are required courses for the MPH, because we're trying to focus more on quality and safety, as opposed to all of the many disciplines, including basic biology and environmental health and so forth.
Yes, so my understanding when I get this question, I mean, they both have foundation courses like epidemiology and biostatistics. The MPH has different concentrations, but my understanding, Dr. Wu, is that you cannot select courses from the Masters in Patient Safety for your MPH.
Yeah, actually this curriculum is exclusively for OPAL students in this degree. There are exceptions periodically. People can petition to take a course. It's been done. We did have a number of people take the infection prevention courses in the last 2 years, as you might imagine, because our courses were better than what else was available in the larger master's curriculum, which is not surprising since it's being taught by the people who are running the number 1 and number 2 people in infection prevention at Johns Hopkins.
So another question that ties in with the MPH, is this course more practical, whereas the MPH is more academic?
This is certainly aimed to be practical. I don't know if maybe the MPH is a bit more academic. I think the MPH is much broader, and this is more focused. The MPH teaches you some skills, but a real focus of this course, of this program, is to give you tools that you can use if you were, for example, a patient safety officer. We have a source of letters for recommendation. I think that you can certainly ask anyone from your previous life who you think knows you well enough to write a good letter of recommendation for a letter. We certainly get letters from people who are not current employers or current peers of applicants. So Amara is asking about instructors. I'm not sure what else would you like to know about instructors. In general, all of our instructors are working in some aspect of patient safety in the Armstrong Institute and at Johns Hopkins. So they're all employees of the health system and or the university, or both, and are doing this as, they're doing safety and quality as their job. And I think for that reason, many of them are the leading experts in their topic, and so can be both academic and practical.
And the faculty is listed on the website, so you can actually look at the faculty and look at their background as well. And I think that would provide additional information for those that are interested in more details on the instructors.
Yeah, I think there's no program that has a better qualified group of faculty. That's quite clear. Or at least there's certainly no online part-time curriculum. If you were to go to Harvard and do a 2-year on-site patient safety fellowship, I think the faculty there are quite good, but this is not, this has different requirements.
This may be our last question. For those of us who work full-time or more than full-time in medical practice, is this course flexible enough if we have a really busy week We cannot do any study one week and then dive in the next week to catch up like on a weekend.
So absolutely. There are also occasions where people, depending on what's happening, more in the last 2 years, people have taken off entire quarters, and we've readjusted, sort of their schedules to stretch their particular schedule out further. But it's perfectly reasonable to, if you're on service somehow for a week or two, to completely turn off. And people can get extensions in work, if they have a good, sort of a good rationale.
It's always good to work with your professor, but it is designed for the working professional and understanding those that are in the healthcare field, how demanding that can be. Now that may be our last question. Thank you everyone for all your continued great questions. Dr. Wu, any last comments that you would like to make?
Well, this is the most active Q&A session that we've ever had for one of these open houses. So I think people are asking the right questions. For some of you, I think that this program could be a real benefit. This is not absolutely for everyone, but I hope some of you have learned enough to be able to make a good decision for yourselves. And I hope to see at least some of you in the fall.
Well, thank you everyone for attending. And if you have additional questions or excited about starting your application, please do reach out to us here in the admissions office. We do look forward to working with you, and everyone have a great rest of your day. Thank you, Dr. Wu.
Sure, we do have rolling admissions, and we are admitting people, sort of even as we speak. I accepted a couple of applicants this week already. So if you're interested, file your application.
Thank you. Bye-bye, everyone.
Thank you.